hear that a lot. In fact, actually, there are a lot of companies.
A new breed of healthcare supply chain partner. Well, joining us to speak about that today is Dave Bode, Vice President of Healthcare Solutions at DSC Logistics. Dave, welcome.
Thank you, Russell. Glad to be here.
Dave, we're talking about a new breed of partner here in the healthcare vertical, in the supply chain area there. But what does that mean? What does that entail?
Well, Russell, you know, over the last year and a half, I've spent a lot of time in meetings with pharmaceutical and medical device supply chain executives. I've spent time at a number of conferences, and what's become very clear to me are a couple of things. First of all, there's a very wide range of supply chain capabilities and sophistication within the range of medical device and pharmaceutical companies. And second of all, what seems to be, I'm hearing also, is a trend that there is sort of a plateau that's been hit, sort of a peak in terms of what the supply chain partners, third-party logistics companies specifically, are delivering in terms of value. And so what happens is there tends to be a fairly strong focus on cost and driving costs down, which is always something very important to a healthcare shipper and a manufacturer. However, there are other things that are important that supply chain organizations can do and need, and they're expecting those, and they're vocalizing those now. They want them to be more proactive, responsive, more of a partner, bringing ideas to them. And so what the new breed means is we're really talking about an organization that is not only proficient at executing an operational excellence in delivering the supply chain services to move product from point A to point B, but also they bring a solutions approach, a consultative approach, a strategic approach in terms of intellectual capital, partnership methodologies, knowledge-based solutions, and a whole wide range of other things. And so the blend of those really is the new, what I call the new breed of healthcare supply chain partner.
You know, if I'm wearing my 3PL hat right now, I might say, well, hey, I do that. I offer those things. So I guess the question to you is this: what makes this type of 3PL partner different from others?
I hear that a lot. In fact, actually, there are a lot of companies that claim to be those kinds of things. The reality of it is I don't think they might be delivering those on a spot basis, or when the customer is actually asking or defining the requirements. So they tend to be reactive in doing those things. And so the new breed of partners is an organization that's actually proactive in bringing those solutions. They're reading the landscape of the customer. They understand what it means to be providing to a bunch of hospitals. And they go, how can we use the information we have and our intellectual knowledge that we have and our leadership skills to say, what solutions can we bring to you? That's not something that I'm hearing a lot that's being done. I hear a lot of talk about it. I don't hear a lot of it being done.
You know, here's a question. Just because somebody's in the 3PL space and they, may do some of this type of work that you're talking about, are all of these 3PLs a good fit for all life sciences or medical device companies?
That's a very good question. Could they be? Certainly. They probably aren't, and here's why. Being ready and being open-minded about what the third-party logistics company can do for you is something that's very important to being open to seeing new solutions being presented to you. We have had customers ourselves. We have provided very proactive, strategic-focused solutions, and they haven't been recognized. They've sort of fallen on deaf ears. On the other hand, we've had some that have run with it and have seen the difference between us and others that are managing other facilities in their network and said, we just continue to go up we escalate up the value chain in their minds, and we keep getting more and more responsibility. So I think what that points to is that are they open to the idea that you can be strategic? And B, what are they going to do once they understand the kind of value you deliver in that area, and is that something they want and need? If they don't, chances are they're going to sort of keep it right there until either it plateaus or goes away or gets increased, it gets escalated in value.
It occurs to me, Dave, that a viewer might say, all right, I'm liking what I'm hearing, but Dave, give me a specific example of a solution that one of these new breed providers is going to offer me. What would you say?
Actually, that's even a better question, because I just ended up having a meeting here at this conference with a very large manufacturer of medical devices, consumer healthcare products, and pharmaceuticals. And he proceeded to outline exactly the kind of challenge that they have, and I could comfortably say, here's what we've done for a recent customer. And what that is they've got multiple divisions with very different supply chains today serving the same customer. And they have duplicative efforts in serving that customer. And I said, so what are you looking at? What's the cause? What problems does that cause? He says, well, you've got a CEO that's saying, I want a sales report by customer for all my business, which simply can't be created by this customer right now. And saying, well, that was not necessarily the same driver for the customer that we're working with, but what they did do is they wanted to drive cost out and take advantage of synergies. And so what we did is we actually ended up bringing two different ways. We ended up bringing the different business units inventory into our facilities and managed them separately, independently. In some cases, divisions didn't want to do that, so we actually ended up keeping them separate. And at the time that there were shipments coming into the organization, into this organization's orders, they sent those to us through different systems. We ended up consolidating those through our own system. We ended up identifying where there were shipments going to common consignees, shipping locations. We identified how those were shipping, because you can't go about all of a sudden changing the way things are shipped without checking with the hospital provider, because they might have a very strong preference for parcel versus over a truck. And so we identified the things that were important to them and said, here's how we can actually, identify where those consignees are that are shipping to the same locations from these different divisions, and then proceeding to say, is this something you want to pursue? They might say yes. In fact, and then we'll try it. If they like it, what they'll then do is they might end up turning it into a upselling opportunity or a cross-selling opportunity across business, or potentially what I've heard is called solution suite selling. So they turned what was a supply chain initiated capability then into a proactive marketing campaign, proactive marketing product to go to that customer.
That's a great little case study. Final question for you, Dave. Let's face it, there are hundreds and hundreds of logistics providers out there.
There are.
But you've convinced me I need to find one of these new breed providers. But how am I going to know I'm talking to one? How am I going to recognize that I'm speaking to one of these new breed 3PLs? What am I looking for? What do I have to hear?
Well, I think one of the most important things is when somebody says partner, you have to drill down into what they mean by partner. Have them say that, and then say, what are the methodologies that you use to partner? I mean, if you don't have methodologies, any format you're following, then it's pretty much a free-for-all, and you could be treating it one for one, you know. And we have a methodology. DSC has developed a methodology for engaging with our customers at multiple levels in the organization, and it's for the purposes of saying, let's understand and align with your goals and your values. Are you talking to a company that's talking to you like that, or they just say partner, and that means just doing whatever you want? We'll work together and ultimately doing what you want. So partnership is one thing. Asking them about what's their approach to proactively bringing ideas to you. How, give me some examples about how you've brought ideas to your customer. Okay, those are probably the top two. It's probably listed about 10 or so more, but those are the top two that I can think of off the top of my head.
Well, valuable information going forward, because clearly not all 3PLs are created equal here. Dave, listen, I know you're busy here at the conference, but you found time to meet with us. Thank you very much.
Russell, I appreciate the opportunity. Thank you.
That's Dave Bode, DSC Logistics, and speaking with us today about a new breed of healthcare supply chain partner. Well, thank you for watching.